Welcome to Swedish American Hospital. Thank you. Boy, you do it all. Still sending chills down my spine, George. Before I get into my remarks, just a few heartfelt thanks. Of course, to Swedish American Health System. You're a world-class organization. You've invited us to Rockford, and we're very honored and pleased to be here. And I echo your sentiments. Thanks to Don, thanks to Ann, to Noah, and Jadiah. They're top professionals. Also want to recognize, or actually share with you that this week is our national recognition of community health centers. And it's my experience and my observation that you won't find a more passionate, a more accomplished leader on the national level than Gordon Edgars from Crusaders, who does everything he can to represent the need in this community and always ensuring that the national perspective is aware of what happens in this community. So Gordon, thank you, and thank you to you and your staff for supporting us and being here in Rockford. Also want to thank the City of Rockford's Mayor, Larry Morrissey. Thank you for your letter of support. Also want to thank the Winnebago County Board Chairman, Frank Haney, for your support. The Winnebago County Health Department, Sandy Martel, who I've known for years. She was back in Cook County, and that's a very complicated system to work at. And I know she's doing great things here, so it's so great to have Sandy here. And then to our partners at Rosecrans, Phil and Dave, who right from the beginning supported us in coming in. I don't have to stand here as a representative of Aunt Martha's to tell you, because I think you know this, what an asset Bill Gorski has been to the community. When Bill approached me last year, it was obvious that his primary commitment was and concern was for the greater Rockford and Winnebago County communities. Bill wanted to have a response built for mental health, the illness that really permeates this area in a disproportionate way. It really led to a conversation, and the conversation resulted in Aunt Martha's becoming, I think, more knowledgeable about that need. We already know that 1 in every 3 Medicaid patients will be diagnosed with a mental health disease. But we know in this county, 50% of the residents can expect to meet criteria for a diagnosis of mental health condition sometime in their life. And that comes right out of the analysis and the research that's been talked about through studies that have been done by the hospitals in the community, by community partners and city and county government. We also understand that there's a limited number of capacity to treat a person with more than one disorder when it comes down to mental health and substance abuse and intellectual and developmentally disabled people. And our approach is to use an integrated one coming into the community. There's only one county in Illinois besides Winnebago County that has a higher percentage of emergency department visits for things that can be treated in a primary care setting. 15% of ED visits that are unnecessary result in people coming into the emergency department. And we studied that data and thought we can really come in with a state-of-the-art model, a model that would have the patients be diverted away from the emergency department, settle into our clinic, and then have them recognize that clinic as their primary care medical home. Our experience with this work is that over 20% of our clinics are in hospital settings. That's resulted in us serving over 200,000 visits and 45,000 patients, saving the Medicaid system, saving the hospital, saving the community, millions of dollars. So we're excited about that piece of it. But then what happens within the clinic when the patients come in? It'll be that integrated approach that Mike talked about, where there will be a strong connection between primary care and mental health. It's an experience that we've had for 14 years now when we began screening for depression in the primary care setting. Our experience has been that over the past 14 years, every year we've provided mental health services in that way to over 6,500 people per year. with 5,000 of those patients being served by our psychiatrists. A little less than maybe 1,000 are served by the primary care physician. And so what we made a decision to do about 18 months ago was to really expand mental health in a much broader way. So we asked our primary care providers to treat the non-complex behavioral health patient in that primary care setting. So that resulted in us going from about 1,000 patients being served in that setting and about 19,000 visits to, we're on pace right now to serve over 17,000 patients in that setting while providing over 76,000 visits. And we've asked our psychiatrists to take on the very complex behavioral health patients so that we create more capacity on all ends of our healthcare. And right at the center of this is innovation. So when you consider the number of behavioral health visits we're providing at the psychiatric level, please understand this, 80% of that work is happening through telemedicine. So we leverage telepsychiatry all throughout the state of Illinois, where communities and patients would not otherwise have access to a psychiatrist. And we've had that experience for about 10 years now, and we will bring that experience into Rockford. We're very close to consummating a collaboration with our friends at Rosecrance. I expect that we'll start those services sometime in the next month, and then shortly after that, we'll bring that technology and that innovation right into the Swedish American health system. There's one person I want to give a special thanks to, and this is a young lady that was born and raised in the community. When we were exploring this opportunity with Bill and his team, I have to admit I didn't have a strong sense of the Rockford community. And so I went to her and I said, give me a sense of what Rockford's like. And without hesitation, she talked about the spirit and the pride that this community has. You have my commitment that we will come in and collaborate with all levels of care. And that young lady's name is Elizabeth Grazanzio. And I don't know where she's at. I know she's around. Liz, where are you?
Liz.
So if she's not Rockford's favorite daughter, she should be. This is Liz. Thank you, Liz. She's very well integrated in the community. Her family has great businesses here, restaurants. In fact, we're having lunch afterwards. I hope they're going to set up, right? Okay. Okay. Thank you, Liz. So yes, I too had the pleasure and honor to have dinner with you, Mike. And it's been 6 weeks since you've been in this role, and I don't have to tell you what an impressive executive he is, who really cut his teeth in the emergency department, dealing with intensive and crisis-centered patients. And for him to have handled that, I'm sure doing this work won't even compare to what you've been through already. What was interesting is that Mike asked me a really great question. And the question was, what do you think success looks like in a year here at Rockford with our collaboration? And I thought about it, and we talked through it, and I think what success looks like is having Swedish American, Aunt Martha's, Rosecrance, Crusaders, the other hospitals in the community, the other providers, all of us who touch all these community members and patients in many ways, but we don't always have the benefit of talking to each other. And if we can establish an integrated health care home model in the state, it will lead the state undeniably in that kind of care. Finally, I want to thank my staff. There's probably about 30 of them here. And don't worry, we're an organization of about 800 people, so there's still people out there running the organization. But this is a big day for them because they worked right alongside Mike and Bill's team in a seamless way. I would have thought we would have known each other about 10 years, the way we got this thing going in less than a year. And thank you to our staff, and thank you to our board of directors who came from various parts of the state. One I know came from Danville, Illinois, so she's here, and our vice chair, Rick, who came from the south suburbs. Without the board support, And without the staff's hard work and dedication and passion, simply would not be here. Finally, thanks again to Swedish American. When I first came in to meet with the staff sometime last year, you walk through the doors, and like any of us who patronize a business, you get a sense of what that business is about when you walk in. You know what the experience is going to be. And walking through those doors sometime last year, I knew what that experience was going to be. It's a world-class organization again. Thank you, and thanks for welcoming us. Thank you.